Good morning to everyone. Today we are going to study about the mental illness and the treatment used in that. So mental illness has two principal types. One is the psychosis. So it's a severe illness, distortion of the thoughts, behavior, capacity to recognize reality and perception. That are these are hallucinations and delusions. Another condition is the neurosis, that is, which is less severe. Its ability to comprehend the reality is not lost, though patient may go extreme suffering. So these are two basic types of the mental illness: psychosis and neurosis. So types of psychosis: first is the cognitive disorders. Another one is the functional disorders. So in cognitive disorders, these are as delirium and dementia with psychotic features and pathological cause. While in functional disorders, there is no cause, thoughts, behavior, and emotions are altered. In functional disorders, main diseases are there. So first one is the schizophrenia. That is split mind, that is splitting of perception and interpretation from the reality. These are hallucinations and delusions. Second one is the paranoid states with marked fixed delusions or false beliefs and loss of insight to abnormality. Third one is the mood disorder, that is depression and mania. In depression, it is sadness, loss of interest and pleasure, guilt, physical and mental slowing, and self-destructive ideation. Second one is the mania. So in this condition, there is irritable mood, reduced sleep, hyperactivity, uncontrolled thought, and speech. And it may be along with the violence. It could be possible. While in another type of mental illness, which is neurosis. So there are some types. So first one is the anxiety. Anxiety is unpleasant emotional state with tension, worry, uneasiness, concern for future. Second one is the phobic state. That is fear of unknown or some persons, objects, or situations. Third one is the obsessive compulsive disorder, that is OCD. So it's a recurrent instructive thoughts or ritual-like behavior, which the patient realizes abnormal or stupid. But even though the patient is unable to perform, the patient is unable to stop by voluntary effort. Fourth one is the reactive depression. It is due to the physical illness, loss of self-esteem. Fifth one is the post-traumatic stress disorder. It is a varied symptom after war, riots, earthquake-like situations. Sixth one is the hysterical type of the neurosis. It's a dramatic symptom as serious physical illness, but situational and always in the presence of others. If the patient will alone, it will not be occurred. So here we have the psychotropic drugs. So in this first one is the antipsychotics or neuroleptics. In all functional psychotics, we can use these drugs in the schizophrenia. Second one is the antidepressants. In mood disorders, it can be used in minor and major depressive illness, phobias, obsessive compulsive disorders, and in the anxiety conditions. Third one is the antimanics or mood stabilizers. It controls the mania. Anti-anxiety in anxiety and phobic conditions, we are going to use this. Psychotomimetics. These are drug of abuse, that is cannabis and LSD. So here we have the antipsychotics or neuroleptics drugs are used in schizophrenia. So what is schizophrenia? This is a split mind where the main symptoms are hallucinations. It would be auditory and visual. So schizophrenic disorders, it's a psychotic disorder because it is characterized by a loss of contact with reality. Schizophrenia means split mind, as mental functions do indeed become split from each other and detached from the reality. So these are some signs symptoms of the schizophrenia as the patient think like, who am I? And there are some hallucinations also. Where am I? Look how sneaky that guy looks. I just don't care. So these are like things. What are that sounds? Some auditory hallucinations are there. So it's a joke-like statement, but this will give the better understanding of the schizophrenia. So that is when the people talk to God, it's called prayer. But when God talks back, it's called schizophrenia. So this is actually auditory hallucination. So the statements that would be in the auditory hallucinations, like what are those voices coming from? I saw elephants under my bed. Maybe I'm Jesus. They're following me. Aliens are contacting me. So these are some thoughts distorted. So here we have two types. That is, one is auditory and visual hallucinations. In US, schizophrenia affects approximately more than 2.4 million. It's a little bit old data. So the nature of schizophrenia. So mainly two factors are there. First is the genetic predisposition, and another one is the environmental, social, and psychological factors. So when these both factors uh, add on, so finally they develop the neurodevelopmental abnormalities and target features, and finally this results into the brain dysfunction, improper balance of the chemicals, and finally there is occurrence of schizophrenia. So in schizophrenia, the four domains of the psychopathology we have, the one is the positive symptom, another is the negative symptom, third is the mood symptom, and fourth one is the neurocognitive symptom. In the positive symptoms, we have the hallucinations, delusions, paranoia, thought disorganization. In negative symptoms, the patient will have affective flattening, improvised speech, ambivalence, anhedonia. In the mood symptoms, there is dysphoria, anxiety, agitation, and suicidality. In neurocognitive symptoms, patient will feel the distractibility, learning deficits, memory deficits, abstract thinking, impairment. These are all the factors will develop the social and vocational disabilities and various medical comorbidities. In positive symptoms, uh, the positive refers to overt symptoms that should not be present. These include hallucinations, delusions, disorganized thoughts. Negative symptoms. Negative means that does not refer to a person's attitude, but instead to a lack of characteristics that should be present. These include reduced speech, even when encouraged to interact, that is logia, lack of emotional and facial expressions, affective flattening, diminished ability to begin and sustain activities, evolution, decreased ability to find pleasure in the everyday activities, that is anhedonia, social withdrawal, asociality. In the cognitive deficits, there is difficulty with the following aspects of the cognition that can make it hard to live a normal life or normal living. That is memory, attention, planning, and the decision making. So these are some important factors. That is positive symptom, negative symptom, and cognitive deficits. This is somewhat auditory hallucination. These are some sounds. In visual hallucination, there will be some visual appearance like things, some hollow images that would be possible. So these are elementary flashes of light, partially organized patterns, completely organized visions of the people's object or animals. So this would be a little bit dangerous, but the basis of that it can be controlled. So pathophysiology, it is yet not exactly understood. But overactivity of the neurotransmitters, mainly dopamine and probably others, including glutamate, serotonin, and the noradrenaline in the brain. So this would be the some basic concept to develop some basic theories. So there are three theories has been developed. First is the serotonin theory. So in this, the LSD-like serotonin agonist modulate the serotonin and that is 5-HT and noradrenaline release at many sites. Most of the atypical antipsychotics act by blocking 5-HT2A or influencing noradrenaline receptors and some by stimulating 5-HT2C receptors. So this is the serotonin theory. Second one, main theory, that is the dopamine theory, that is proposed by scientist Carlson. In this theory, the drugs that increase the dopamine activity in the brain produces psychotic episodes akin to schizophrenia. That is, amphetamine increase the dopamine release, while drugs that decreases the dopamine activity in the brain controls the symptoms of schizophrenia. That is dopamine blocker. That is chlorpromazine, that is CPZ, dopamine storage depleter like Reserpine, which is obtained by Indian herb Provolfia serpentina or Sarpagandha. Third one is the glutamate theory, that is NMDA receptor blockers like ketamine and the phencyclidine produce symptoms of the psychosis. The postmortem finding: decreased glutamate concentration and decreased glutamate receptors density found in brain of schizophrenic patients. So there are basic 5 types of the schizophrenia. One is catatonic, paranoid, undifferentiated, disorganized, and residual type. So in these 5 types of schizophrenia, first, which is very much common, that is paranoid type of schizophrenia. That is, it is characterized by delusions and auditory hallucinations, but relatively normal intellectual functioning and expression of the affect. This is what my doctor classifies me to be like that. So the disorganized type of schizophrenia is characterized by speech and behavior that are disorganized or difficult to understand and flattening or inappropriate emotions. Catatonic type schizophrenia is characterized by disturbance of movement. Undifferentiated type of schizophrenia is characterized by some symptoms seen in all of the above types, but not enough of any one of them to define it as another particular type of schizophrenia. Residual type schizophrenia is characterized by a past history of at least one episode of schizophrenia, but the person currently has no positive symptoms like delusion, hallucinations, disorganized speech or behavior. So what is the status of the schizophrenia? Approx in the world population, there is 1% of the whole population is affected with the schizophrenia. History of the treatment of schizophrenia. So we are focusing about the treatment. That has started in the 19th century. Psychosis first broadly conceptualized as an illness. In the late 19th century, schizophrenia defined. In the early 20th century, treatments, adrenaline-induced fever or vasectomy or adrenalectomy has done. In 1930s, treatments, that is insulin coma, electroconvulsive therapy were used, chemoconvulsive therapy were used. In 1950s treatment, the Reserpine, Indian herb. Another one is the chlorpromazine, haloperidol has been used. In the 90s treatment, we have the much better drug we are using still now these days, that is clozapine, risperidone, olanzapine, quetiapine, ziprasidone, and aripiprazole. So the developments in the treatment of the schizophrenia. The third is ECT, electroconvulsive therapy, was started in 50s. CPZ has introduced in 60s haloperidol, flufenazine, thioridazine, loxapine, like drugs were used. In 80s, clozapine has been tried. In 90s and 2000, risperidone, olanzapine, quetiapine, ziprasidone, and aripiprazole. In 2006 to 8, there are development of some new drugs, that is asenapine, bifurinox, paliperidone were introduced. So in the earliest, the drugs are known as the typical antipsychotics, and now these days what we are using more that these are atypical antipsychotics. The history of antipsychotic drug development. Between 1954 and 1975, about 15 antipsychotic drugs were introduced in the United States and about 40 throughout the world. Thereafter, there was hiatus in the development of the antipsychotics until the introduction of clozapine treatment in the United States in 1990 opened the era of atypical antipsychotics. So here we have the exact classification of the antipsychotic drugs. So the first generation is known as the typical, the old one, typical antipsychotics. So the broad category is the phenothiazines, that includes chlorpromazine, triflupromazine, trifluperazine, flufenazine. Second category is the thioxanthines, that is thioxanthine, flupentixol. Third one is the butyrophenols. So that is the main drug, that is haloperidol, very useful now these days still. So that is another one is the trifluperidol. So now what we are using now these days more, that is much better drugs, newer drugs. So these are second generation of atypical antipsychotics. These are clozapine, olanzapine, quetiapine, risperidone, ziprasidone, aripiprazole, and amisulpride, etc. And somewhat miscellaneous or other drugs like reserpine, loxapine, and pymoside. So mechanism of action of antipsychotics. First generation or typical antipsychotics, they mainly block the dopamine D2 receptors in the limbic system and the mesocortical areas. Second generation or atypical antipsychotics mainly block the 5-HT2A receptors, serotonin receptors in the mesolimbic system. So first generation antipsychotics are D2 blockers or antagonists, as like you can see, they are blocking in the mesolimbic area, the dopamine D2 receptors. Second generation antipsychotics are serotonin blockers, 5-HT2A antagonist. So clozapine was the first SGN. So they have actually very high affinity for the 5-HT2A receptors, while they have the lower dopamine D2 activity than haloperidol. So this is the thing to remember. Actions of the antipsychotics. CPZ is a prototype. So in schizophrenic patients, it's it has the CNS actions, autonomic nervous system actions, CVS actions, endocrine actions, tolerance and dependence, and others. So we are talking about CNS actions. Chlorpromazine CPZ blocks the dopamine receptors in the limbic system and mesolimbic cortical areas. That finally results in antipsychotic effects as follows. It decreases the agitation and aggressiveness, decreases the spontaneous movements, decreases the hallucination and delusions, decreases the anxiety and corrects disturbed thoughts and behavior. CNS actions of the antipsychotics. CPZ blocks the dopamine receptors in the CTZ, in the chemoreceptor trigger zone, that results in the antiemetic effect. CPZ blocks the dopamine receptors in the basal ganglia, which which occurs causes the occurrence of the EPS. Cns actions of these drugs. So CPZ blocks the alpha adrenergic receptors, results in postural hypotension, tachycardia, and palpitation. CPZ blocks the muscarinic receptors, which results in weak anticholinergic effect occurred. So these are dry mouth, blurred vision, constipation, urinary retention. It again blocks the histamine H1 receptors, so causes weak H1 antihistaminic effect, like sedation, antipruritic effect. CPZ blocks the serotonin 5S2 receptors, causes the antipsychotic effects. While in CVS action, primarily causes the postural hypotension by central and peripheral actions through alpha receptor blocking activity on sympathetic tone. In the endocrine actions, prolactin inhibitory factors, PIF, is dopamine. Due to blockage of dopamine due to receptors by CPZ, it causes the increase in the prolactin production, which leads to or leading to in females galactorrhea, amenorrhea, and infertility. While in the male, it causes the gynecomastia. Tolerance and dependence. Within few weeks, tolerance develops to its sedative and hypotensive actions. No physical dependence occurred due to no pleasure. Pharmacokinetics of the CPZ. Absorption, orally unpredictable, and intramuscular or intravenous use is good. Absorption is good. Distribution, there is highly bound to plasma and tissue proteins. Brain concentration is higher than plasma concentration, so volume of distribution is very large, 20 liters per kg. Metabolized by the CYP2D6 enzyme in the liver. Excreted in urine and bile, and the T half of this drug is 18 to 30 hours. Side effects of the typical and atypical antipsychotics. So there is a wide range of the ADRs, like weight gain, cataracts, sexual ADRs, hyperlipidemia, myocarditis, prolonged QTCL interval, could be possible of the diabetes mellitus, extrapyramidal symptoms, or EPS. The thing what we have to remember here, that the EPS, which includes many things like dyskinesia, akathisia, diabetes syndrome like things, it is more common in the typical antipsychotics, in the old generation antipsychotics. But in the newer generation, on the basis of control dose, this is very less occurrence is there. It is much more safer. So in older one, the EPS occurrence is very high. So what is EPS? Extrapyramidal symptoms. So it includes many things like pseudo-Parkinsonism. In this, there is a stop posture, shuffling gait, rigidity, bradykinesia, tremors at the rest, pill rolling motion of the hand. In another EPS is the acute dystonia, facial grimacing, involuntary, upward eye movement, muscle spasm of the tongue, face, neck, and back. Back muscle spasm cause tongue to arch forward. Laryngeal spasm can be also possible. Another main EPS is the akathisia, that is a restless movement of the leg or hands. Patient can continuous walk throughout the night or day, like these things. Trouble standing still, paces the floor, feet in constant motion, rocking back and forth. Another EPS is the tardive dyskinesia, protrusion and rolling of the tongue, suckling and smacking movements of the lips, chewing motion, facial dyskinesia, involuntary movements of the body and extremities. So these are the main symptoms of EPS.